100 years has passed since the first introduction of Alzheimer's disease. Since then, billions of dollars has been spent in an endless effort to understand this disease. Some great achievements have been made. However, we are far from over. With a global prevalence of 17 million and a financial burden of $172 billion, Alzheimer's disease is still the #1 cause of dementia worldwide, and conditions are expected to get worse in the future. So there's an urgent need to further expand our understanding of this devastating dementia. One of the aspects of Alzheimer's disease is its non-cognitive symptoms. Symptoms such as depression, anxiety, apathy, agitation, hallucinations, delusions, sleep, appetite, irritability, and motor disturbances and disinhibition. These symptoms were used to be referred to as the behavioral and psychological symptoms of dementia. However, today they have gained lots of attraction under the newer term of neuropsychiatric symptoms of dementia, or NPS. These symptoms are so common that they are the norm rather than the exception, so they can act as good mirrors of what's happening in Alzheimer's disease. However, what is the exact relationship? Are they prodromal signs? Are they risk factors, or a reaction to Alzheimer's disease, or simply nothing? Well, researchers at St. Michael's Hospital in Toronto, led by Dr. Fisher and Dr. Shoraki, are trying to answer this question by focusing on the cerebrospinal fluid biomarkers of Alzheimer's disease. Today, we know that in the CSF of patients with Alzheimer's disease, there are high tau levels, low amyloid levels, or both high tau plus low amyloid levels. The last one, which is referred to as the Alzheimer's disease signature. These biomarkers are correlated to Alzheimer's disease. But are they correlated to the neuropsychiatric symptoms? If we find out, then we can connect the neuropsychiatric symptoms to Alzheimer's disease. So the question here is, neuropsychiatric symptoms in patients with Alzheimer's disease, are they correlated to the Alzheimer's disease CSF biomarkers? Well, an extensive systematic review has revealed some interesting results. First and foremost, agitation and aggression was the most consistent NPS associated with Alzheimer's disease CSF pathology, or in better words, all studies that were evaluating agitation and aggression reached the conclusion that if a patient with Alzheimer's disease has agitation and aggression, most likely it will have a worse CSF pathology, meaning higher tau levels, lower amyloid, or both higher tau plus lower amyloid. So the lesson from here might be that if a patient with Alzheimer's disease has or had agitation and aggression, it can be a sign of an underlying disease process, which in our case is dementia rather than anything else. Plus, it might also be concluded that if there is severe CSF pathology, it will be more likely for the patient to become agitated rather than others, so a regular NPS assessment might be warranted. However, what about the other NPS? Depression, anxiety, hallucinations, delusions, apathy, irritability, sleeping and eating problems. Are they present associated with Alzheimer's disease CSF pathology? Well, it's not that straightforward. Both yes and no. Some studies were saying yes, there is an association, and some studies were saying no, there isn't an association. However, whenever the answer was yes, it meant that the presence of NPS was associated with a worse pathology, or in better words, the presence of a neuropsychiatric symptom was not a good sign. It was an indication of worse pathology. However, there was an exception: depression. Depression was the only neuropsychiatric symptom that its presence was sometimes associated with lower CSF pathology, or maybe you can say it was protective. But why depression occasionally had such associations while others did not? I don't know. Maybe it's because it's mistaken with mild cognitive impairment, or it's the most studied NPS, Or maybe various methods of measuring depression led to heterogeneity, or because of not differentiating recent lifetime treated depression from each other. Anyway, more studies are needed to find out what is the exact relationship among neuropsychiatric symptoms, Alzheimer's disease, and the CSF biomarkers. Are these symptoms prodromal signs? Are they risk factors? Are they a reaction to Alzheimer's disease? Are they a good sign or a bad sign? Well, it is also important to remember that future studies should all follow a standardized protocol in order to increase the objectivity and decrease the bias. Hopefully, in the near future, we will have a more clear picture of what is going on in Alzheimer's disease and the neuropsychiatric symptoms.